everyone, my name is Francine P. Altura, and today I will be performing a return demonstration on rectal and vaginal administration. Let us begin. For the first part of this return demonstration is to perform hand hygiene. And check the room for additional precaution. This means that close any curtains and lock the doors to provide privacy and so that your patient will feel comfortable during the duration of this procedure. So I have already done those also. Next is to introduce your name, yourself to your patient. So hi ma'am, my name is Francine P. Altura, a student nurse from the University of San Agustin. So then it took, after you introduce yourself, confirm the identity of your patient. So may I please ask your name, or may I please know your name and your birthday, ma'am? Okay, thank you. So once you have confirmed those, check the allergy band if there are any presence of allergy. So let's say this is the allergy band. So patient name is stranger, and then note no allergies present. Okay. Once you have done that, assess for the vital signs of the patient. So assuming that I have already also done those, I check the temperature of my client, the pulse rate, the heart rate, as well as the blood pressure, and they are all within normal ranges. Now to begin with the return demonstration, first is the rectal administration. So the first step is to check the MAR, which is the medical administration record, against doctor's order. So this is to verify consistent with what the orders the doctor has given. So I have here a makeshift medical administration record, and then verifying. Okay. Once you have confirmed that they are consistent, you can now proceed with performing the 10 rights of the patient. So we already have done some of those, which is the right patient, you have confirmed that. The right medication, which is according to the doctor's order and the MAR. This suppository I made also this suppository, I made it out of glue stick because I was not able to have my hands on an actual one. So, and then you also have confirmed the right dose, the right route, which is the rectal route, the right time and frequency, and then documentation, and then so on. Next step of this return demonstration is to check the label for the name, the dose, and route, and compare it with the MAR at 3 different times. These times are when the medication is taken out of the drawer, so before, when the medication is being given, which is during, and then when the medication is being put back to the drawer, which is after. Okay, after you have done those, before proceeding with administering or giving the medication, if possible, have your patient defecate before administering the medication, because medication should not be inserted into the feces and it will not take effect in the body. So, Miss Stranger, may I suggest that you defecate before we proceed with the administration so that the medication will take effect. Okay, thank you. So after that, ensure that you have a water-soluble lubricant available. So I have here a packet of a food thickener that I will be using as an alternative of a lubricant because I was not also able to get my hands on those. So I have that available here. So using lubricant will reduce friction and will help with administering the medication with ease. And then explain the procedure to the patient. So today, Ms. Stranger, I will be doing a rectal administration of medication. This is where I will be inserting a suppository from or in your buttocks to relieve the constipation that you are feeling. So you are allowed to choose if you want me to be the one inserting the medication, or you could do a self-insertion. So which of the two options would you like, ma'am? Okay. Oh, you want me to help you? Okay. Okay, to begin with, raise the bed to a working height. So I don't have a bed that could be raised. So I have here a, let's say, an examination table where my patient will be staying at. And then, so position the patient on their left side. Okay, excuse me, ma'am. So, right, left. This is the left side. And then with their upper leg flexed over the lower leg towards the waist. So, like so. This is, it's not very visible. So, this is what it looks like. I have here a printed copy of what it's supposed to look like. So I have helped my patient assume this position, and this is what it looks like. Excuse me. Okay, this is what it looks like right there. And then this is called the Sims position. This position helps prevent injury when administering the medication, and protects the patient's privacy, and also helps relax the patient. So next up is to provide privacy by placing a drape over the patient with their buttocks and anal area only exposed. So I will be doing that. So I have here a drape, then draping it over where the buttocks and also only the anal area are exposed. And then also place a drape underneath the patient's buttocks. This is to protect the linens, which are like these, from possible fecal drainage. So, okay, so I have here another drape. So placing it underneath the buttocks of the patient. Be substituting that with this. Okay, so this is what I did. And then I am now gonna apply non-sterile gloves or clean gloves, which I have right here. Open the packet of a suppository and lubricate it with my makeshift lubricant. So opening the suppository, so here, opening the suppository. Okay, so this is the suppository. So usually, or most suppository, it should have a bullet end, or a very blunt end, but I was not able to imitate that. So I have here. So this is the bulleted end, and this is the flat surface. So again, this is the bullet end. Okay. I'm gonna use a ball pen to show it. Okay. I am now gonna lubricate the suppository and the tip of my index or forefinger. So, opening the makeshift, what do you call it? Lubricant. So I have it here. Oh no, okay. Then, taking the suppository out of the packet. So, okay, so I should have only there a little bit. Okay, wait. So the next step is to separate the buttocks using my non-dominant hand. So this is what I'll be doing. So separating the buttocks using my non-dominant hand, okay? And then inserting the suppository with the rounded tip first and do this, okay? Once you have done that, it will pass through the rectum toward the umbilicus. So keep inserting. So when doing this, ask your patient to take a deep breath and then exhale through the mouth. Stranger, take a deep breath and relax through your mouth. So keep inserting until you reach the 5 centimeter beyond the anal sphincter. Then remove your finger, okay? Wipe the anal area of your patient. And then ask your patient to assume this position or hold this position for about 5 to 10 minutes because this will help prevent the medication from going out of the rectal area. After 5 to 10 minutes, you can now discard of the gloves. Okay. After asking your patient, discard of the gloves that you have been using, the waste receptacle, and then before leaving the area, ensure that a call bell, which is used to alert somebody, is nearby and a bedpan or commode is available to be used. This is because a suppository is a laxative or a stool softener wherein the patient will require to urge to defecate. Now, once that is done, includes the patient's tolerance of administration. This is because timely and accurate documentation ensures and promotes patient safety. That would be all for the rectal demonstration. Thank you.